right, we're rolling.
All right, guys. Welcome to the Cappy family.
Kevin, what's up?
What's up, Joe?
Okay. Today is the first Cat PT podcast. And what we're going to be doing today is just kind of going over what we do here at Cat PT, give you guys some information on exercises, techniques we do in here, and then just kind of continue the conversation of what we typically talk about in physical therapy.
The friendly banter that we always
the friendly banter. It never stops.
It really doesn't.
So we might as well continue it.
This makes it like the best work experience I've literally ever had.
That's so kind. You're just doing that for the camera.
I am.
Yeah, no, I'm just kidding. All right, so today is June 6th. It's a Thursday. It is so humid outside. Didn't go for a run.
People are coming in with like their frizziest hairs ever.
Yeah, it's
I
great.
forgot who it was, but I was like, what's going on with your hair?
All right, so I am Joe Caprioli, owner of Cap Physical Therapy. I got Kevin Chu with me.
Yep.
Physical therapy assistant. He's the man. Elvis.
There we go.
Here we go. Ready? Love the shades. Love the shades. Okay, so, guys, today's the NBA Finals. Game 1, 8:30.
Mavs in 7.
Mavs in
7. Who do you got?
I have some unfortunate news.
What?
It looks like the Celtics are not wearing their green jerseys at all. It's black and white.
That's how you know.
Ooh.
That's how you know they're gonna lose.
Celtics by 100.
By 100? No. I think the Mavs are gonna lose. I mean, they're gonna win Game 1. I think they're gonna steal it.
I think the Celtics are gonna win.
There's no way. Jason Tatum. That's my guy, Duke.
Yeah, but you hear all these things. How he's supposedly so good, but what's the highest score he's had this whole series? 30 something.
He's still great.
I haven't seen him hit one.
He's still great. Look at the competition. They've played nobody.
That's true.
They played nobody.
In the finals, there will be one game he's gonna drop it.
No, he's not.
That's my prediction.
If you would place that bet right now,
It's happening.
Elvis, real quick. Did you bet that one of the games would end in
I bet
a three-pointer at the buzzer?
Would end in a buzzer beater with no time to inbound for the other team. Plus 2,500.
Plus 2,500.
I got to take that.
You got to just sprinkle. Just a little sprinkle. Got to do it.
I don't know. I mean, I think that might happen, but I think just like the Rangers are going to go down.
Wow.
Low blow.
Too soon.
Too soon.
Too soon. Should have gone there. Okay.
Well, speaking of the Rangers.
Speaking of the Rangers, Stanley Cup, Saturday, Game 1.
I think the Oilers are going to take it. Well, we've been talking about this whole time that whoever the winner of the Oilers and the Stars game.
Yeah, we did say that we thought that the winner would come out of the West.
Yeah.
I really thought it was going to be Dallas, but I did bet one of our patients breakfast sandwich. No, this was a lunch sandwich that the Oilers would win. So, hopefully cash in on that. Yankees are crushing it.
Cruising.
Did you hear that this is the second time that they had a 7-game winning streak? I kind of want to put them in
of the season.
Yeah.
Okay.
I kind of want to put them in just with the Mavericks.
Just add it.
Just add it in.
Volpe on base.
What are they playing today?
They're still playing Minnesota.
I think they'll beat them today again.
You think so?
Yeah.
I think it's a sweep of Minnesota.
I was this
They
whole
always
time in the
sweep
beginning. I was like, Judge sucks. Judge is not doing anything. They're just striking out.
He's the GOAT, bro. Come on, I've been telling you.
I hope he doesn't listen to this.
No, it's not going anywhere outside of
It's a long season.
Cat PT walls.
The first month. It's a long season.
It's a long season.
It's like Bambi. He's trying to get his legs underneath him.
Oh, God. It's fine. Kev, you're going away next week.
I know. I don't know what people are going to do at 8 a.m.
What are they going to do?
I don't know.
What are they going to do?
You're going to have to come in.
I can't come in. I got kids. I got to take them to school. It can't happen. It's not happening.
You can bring them in.
You think so?
Yeah, they can work with Elvis. They can get hot packs. I can just see Parker carrying his own body weight in hot packs to the patients.
Yeah. Well, every time they come in, they always just play with those balls over there anyway. So it's just like built-in toys, and it won't be. It'll be a nice, relaxing, calm week without you.
Oh shit! I just got that.
I'm just kidding. All right, but you have a lifting competition.
I do.
Okay, what's going on? Give us the details.
I feel good. This is the first time that I felt like pretty healthy going into it. I definitely can attribute it to the fact that we have like some sort of maintenance going on every few weeks or so. Like
Okay.
big problem of mine is like thoracic extension, being mobile in my spine, and just having like an adjustment every now and then really helps a lot.
Yeah.
Just because like if I don't get that, if I put like weight on my back or something like that, it just feels like really really compressed.
Yeah.
But I haven't had that pretty much this whole time.
Got it.
Yeah.
All right. So you do powerlifting.
Yeah.
And one thing I wanted to just touch on, since this is the first week we're doing this, is what are your stats, bro? Give us the numbers.
Well, I mean,
What are your PRs?
the one that I'm doing now, it's on Sundays called regionals, which is like an embodiment of like all the Northeast regions.
Okay.
So like the New England area, a little bit down. So I believe New Jersey's part of it. Whatever the states are. I'm so bad at geography. I need Parker to give me a lesson or something. Whatever's underneath New Jersey.
Maddox will give you a lesson. Yeah.
Maddox, yes.
Yeah.
Get him on the show.
We'll get him.
Whatever's underneath New Jersey.
Next episode. Whatever's underneath New Jersey. Okay.
All that kind of encompasses together. And if I win, I would say that I'm probably one of the top people in my class in the Northeast region.
Awesome.
And then hopefully I can make it to nationals in Utah.
So that's the goal for this, is to qualify for nationals?
Yeah. Like there's no specific thing that I want to hit. I just want to get to there.
Awesome.
Yeah.
Awesome. But you're going to have just a great time in Maine.
I mean, yeah, I'm going to have a great time in Maine. I'm so excited for the lobster. I'm so excited for the oysters.
Just lobster nonstop.
Yeah.
Nonstop.
I feel so bad because my fiance does not like seafood at all.
Really?
She fucking hates that shit. I can't even cook seafood in the house. And she's like, get this shit out of here.
Oh my God.
And I'm like, I'm sorry, we're eating lobster.
Oh my God. I can't.
But speaking of nationals, like it's in Utah. It's in September.
Okay.
But she's due in September. I might not even go.
Oh my God. Could you? Okay. So, we were watching the Masters and Scotty Scheffler's baby's due, and what's going to happen if his wife goes into labor.
Is that why he was rushing that day?
No, I don't think so. I think that was separate. I think that was just a misunderstanding.
Oh, okay.
He's fine.
I feel like that might be me. Like, God forbid, like I go and then she's like 3 weeks early. She's like, I'm in labor right now. Even though I'm in the middle of the competition, I'm like, book me a flight right now.
Okay, so if you were like mid lift and you got the phone call, are you like finishing your lifts, or are you like you're bolting out of there to go?
I don't know. I think I gotta finish the lift.
You gotta finish the lift.
Sorry, babe, but I gotta finish the lift.
I think so. Hopefully she doesn't see this. Anyway, all right. So that's gonna be great. So no Kevin next week. Kristen Carney will be in throughout the week to give us an extra hand. Question of the day, Kevin. You've been working with us for a year and a half. Questions of the day. It's like people are upset if there's nothing on that board.
Dude, I feel so pressured when people are like coming in.
Put you on the spot.
Yeah, I'm like, I can't think of one.
They're like, what? This question was up here on Tuesday. It's Thursday. What are you doing? Like,
all right, let's see one.
Okay, so question of the day. We're gonna call this segment "There Are No Dumb Questions."
I got one.
What do you got?
All right. So I saw this TikTok about like useful and useless information or useless items for a baby, since we're having one.
Okay.
And one of the things that my cousins got me on the registry that got shipped to our house recently was a diaper pail.
Okay.
What's the use of that thing? We have a garbage can.
There's no way that is a substitute. So, I love having these conversations with you because, to you use your common sense brain. And I totally understand it. And once you become a dad, dude, you're going to be like, we have 3, diaper pails, like nonstop. It smells so bad. Like, it is so bad.
All right.
And you have to contain that. And if you have it in the kitchen, I'm telling you, it's going to be a useful thing. It may seem non-useful, but
let me tell you something.
It's a must-have.
Let me tell you something. I don't know if my fiance knows this, but sometimes when our dog misses the wee pad for poop, I will pick it up and I will put it in the kitchen.
Don't do that.
I will put it in the kitchen trash can.
I can't.
But you don't smell that,
dude. You pick it up and you put it in the toilet bowl and you flush it.
No, you can't flush paper towels in the toilet.
No, but you could flush the actual dog fecal matter down the toilet,
No, but
and then throw out that. And that's
it's never
oh
smelled.
my god, I can't.
It's never
I love
smelled.
this. Okay,
I don't. You can.
all right.
Our trash can is right in
okay.
front of the kitchen. We have an open concept. I'm sitting on the couch. You don't smell that.
So what you're telling me is that in the future, your kitchen trash can is going to have dog poop and dirty diapers in it.
You know,
Maybe
honestly,
no. Now the dog poop goes into the diaper.
we should put
Garbage.
the diapers on the dog too.
That-
That way she can't pee everywhere.
You know, I wouldn't do that. I don't recommend that.
Listen, if it didn't stink up the whole place, I would be okay with it. I would be able to sleep at night knowing.
Yeah.
Yeah.
Okay. I love this. Okay. So question of the day is a diaper pail a necessity?
All right, let us
For-
know. Let us know down below.
Let us know in the comments.
What do you think? Do you think a diaper pail is necessary or not? Useful or useless?
Mandatory.
Mandatory.
That's mine.
Anyway,
That's mine. Okay. Next, we're going to talk about things that are going on here at Cap PT. Definitely been getting busier since we moved to this new location. Every Tuesday, we have Dr. Sudberg's office. He's a physiatrist. PA Matt. Love
That's
Matt.
awesome.
Matt's awesome.
That's awesome.
Matt's great.
Love Matt. We gotta have him on.
Yeah.
He's great. I got to go golfing with him.
He golfs?
He golfs. He
Dude, he
he
looks
crushes it.
No.
He's a lefty. He says like 320 he could hit. That's good.
That's good. I don't know anything about golf.
I know.
Like said on my golf is Angry Birds at Top Golf.
I love it. No, that's good. That's good. Yeah, he's good.
Dude, I think people that can hit a golf ball is just so impressive. Like you're taking the bat that's like a club that's skinnier than a bat, and hitting a ball that's smaller than a baseball. Like, and you're not looking at it when you do you look at it when you swing?
Yes. Keep your eye on the ball.
So you're
All sports.
So you're looking
Eye on the
down.
ball.
So you're looking down at the golf ball as you're swinging.
Yes, that's the hard part.
Maybe that's why I'm messing up, bro.
Yeah, you got to keep your head down. You got to keep your head down.
As I swing, I look at the golf club as I'm swinging back.
Yeah, don't do that. That's not how you do that.
All right.
You need to sit down, watch the Masters, watch some of these championship tournaments, and see how it's done. Because once you see how consistent they are, it is just so impressive. Like, and then you go out there and then you hit one shot like that, and you're like, that's all. 18 holes. If you get that one shot, it's all that matters.
You know, so all I'm hearing is basically if I get that shot down, it could be Tiger Woods.
Yeah.
You know, golf is the only sport that I've probably watched. So as you know, I didn't watch sports before I started working here.
Yeah.
And now I'm betting on Chinese basketball in the morning at 7 a.m.
You should look into betting golf because, Scotty Scheffler, who's the number one player in the world, to win a tournament is still like plus 500.
Wow.
Like, yeah, no, it's
All
like,
right, how do we make this happen? Now?
yeah,
How do we make this happen?
you just wait for the tournament and bet it.
All right.
The normal way. Yeah.
Watching golf. So, like I said, as I've got work here, I've been starting to watch football, basketball, whatever. Golf is the only sport that I will watch on TV. I'm like, I don't think I'd be good at this, no matter how much I try.
Yes. So your level of confidence in everything is very high.
Oh yeah, I'm trying out for the Jets next year.
Yeah. Kevin is going to be a long snapper for the Jets, possibly. No, what position would you play if you were on the Jets?
He's got to go tight end.
You think tight end?
He needs some hands, but he's got to go tight end.
I might be better than Travis Kelce.
Bold take.
Bold take. How tall is Travis Kelce?
Is that the hot take of the day?
Is he like 6'5"?
Yeah, we're about the same height. How much does he weigh?
Oh my god, I can't.
40?
Yeah, we're about the same build. I just need to grow like a beard like
and date Taylor Swift, yeah.
And date Taylor Swift. I don't know if Matt's don't like that, but
okay, never mind. Maybe not. Okay.
Everyone
I love your confidence in everything. It's so wonderful. And yeah, you should not be confident in golf ever because even the best are not good a lot of times. It's a humbling sport.
How's your golf been going?
It's been going. I've been happy to just get out there consistently. That's kind of all that matters to me. The last 3 rounds I've played, I've shot the exact same score, so that's consistently mediocre at best. Okay. But I just got a Bluetooth speaker
For the
for
the
my
cart?
golf cart. Yes.
Okay, cool.
And it's a magnet, and it goes right onto the golf cart.
Nice.
And I could play, some Morgan Wallen while I'm out there.
Ooh.
And it also tells you how far you are from the greens. It has the front of the bunker, the back of the bunker, how it keeps track of how your score, it keeps track of how far you're hitting each club. It's like very
This is kind
impressive.
of like Topgolf.
It is, except it's you have to like manually input a lot.
Oh,
of it.
I see.
So
I see.
like the first shot, I would say I hit my driver, and then I would walk up to the ball, and it knows that I hit it 200 yards.
Okay.
200 yards in the wrong direction.
All right. Let me ask. Let me ask you a
basically
question.
what happens.
So I used to poke fun of you at having kids and then leaving bowling behind.
Yes.
What makes you like more inclined to golf now and make time for that as opposed to a sport that you were shooting 300s left and right?
I think when it comes to bowling, I really like I am good at bowling, so I'm very competitive. So when I go bowl by myself, yes, that's practice, but I would like to bowl in a tournament or bowl in a league and bowl versus people, and like it's that level of competition for me. Whereas golf is extremely casual. I don't care how I do when I'm golfing.
Oh, I see.
It's definitely way more like therapeutic to me from stress standpoints and everything.
Because you don't necessarily want to win. It'd be
No,
nice.
it's golf and bowling are the two sports that it's you, right?
Okay.
So they're individual sports, and you're competing with yourself. And I love sports that are like that, where
I see.
it's as long as I do better than I did the time before, that's all I care about. That's all I matter.
I mean, that's kind of just like lifting wise. Like you just want to lift more than you did last time.
Yeah. So I don't know a ton about lifting and everything like that. So I know that you're trying to everyone always keeps track of their PRs and stuff like that.
Yeah.
But are you just in a weight category and you have to basically lift more than the next guy?
Basically, yeah.
That's it.
Yeah. Basically,
that's it.
Yep.
Okay. And how wide are those categories?
What do you mean, like weight classes wise?
Yeah, weight class wise. Yeah.
Well, when I first started out, it's funny because I used to do track and I would weigh like 180, 185 pounds running the 100 meters. But I think as the years progressed, my dad bod kind of like kicked in more and more. I was like preparing for this moment, and now I'm like 260. I'm gaining like 75 pounds. No, what is that? Yeah, 75 pounds. Jeez.
Attaboy.
But I heard yesterday I went to the barber and I said that I'm getting my dad bod ready. He's like, I prefer to call it father figure.
Okay, I do like that.
Yeah, I like that better.
It's a slightly nicer way of saying the same thing, but yeah. I actually, I think one of my patients, when I first became a dad, got me a shirt that says like it's not a dad bod, it's a father figure.
Yeah.
So that's
I need to get that shirt.
I love that statement.
Yeah, I need to get that
dad
shirt.
bod it's tough, bro.
It's
tough.
Every time I go home, Madison's like, am I the one pregnant or are you the one pregnant? I'm like, this is what I come home to. I don't come home to a hello, honey, kiss, whatever.
What'd you eat today, bro? What are you eating now, Kev?
Dude, let me tell you. I've been wanting to talk about this for a while. And dude, Joe literally makes fun of everything I eat. Literally everything I eat.
Because you eat nothing normal.
This is cottage cheese and strawberries. That's it. It's
all right. I mean, I get it, but I don't get it. I don't get it. It
Dude,
sounds horrible.
I need it. Hold on. Let me think of like something I've been eating.
Do you take like, mozzarella cheese and like put on your grapes?
I don't like cheese, except when it's on pizza.
Okay, I've heard that take a lot.
Like
a lot of
you
people,
see when
I've heard
people
that.
like take like when you're in elementary school and you take that string cheese,
yeah,
and you just bite into it.
I love it.
I would throw up.
Really?
That's disgusting.
That's the best cheese.
That's disgusting.
Incredible cheese.
That's the best cheese.
That cheese is not even real cheese.
That's the goat cheese.
No, the goat cheese. You like goat cheese? Dude, getting into goat cheese, I feel like it's like a path of like.
I love it.
It's
I
good.
love it. It's so good.
It's like an acquired taste though.
It's got a tang.
Yeah,
but it's like creamy, and I love it.
Is it creamy?
It's very creamy.
It's very creamy.
Am I getting the wrong goat cheese?
No.
Am I not getting that texture? Like this is like the time when I thought that
It's not
pickles
like
were like
it's not
strawberries.
like it's not like it's not like it's not like cottage cheese gravy, but it's
Yeah,
like
yeah.
creamier compared to like some of the harder type of cheeses.
You're right. I
It's
can
like
see
on
that.
the spectrum. So anyway, but yeah,
What do you like your goat cheese with?
my wife will just kind of start adding it to salads and stuff like that. So kind of like
Yeah.
basic. I'm always very iffy with cheese. Like it's got to be on the milder end of the spectrum.
You know, that's funny coming from an Italian person.
Yeah, but I was not raised with my Italian family, so
Yeah, but like, okay, do you think? Okay, even though you're Italian, you weren't raised with your Italian family. Do you not like just have like that genetic
no.
taste
Like
bud?
it took me a long time to like red sauce because I hated onions so much. Meanwhile, it's like
Wait, they put onions in red
I
sauce?
can't.
Oh my goodness, Kevin.
Wait, hold on. No, they don't.
Jesus. Well, my wife purees it when she makes her homemade sauce, so it like liquefies it and it just like dissolves into the sauce.
Does she use like a puree machine?
Yeah, I think it's like Cuisinart. Like
Is this like the same machine that you might be
I
able
think
to
it's
use?
food processor.
Could you use this to like make baby food out of like real
Yeah.
ingredients?
Yeah, we used to do that.
We should get that.
We used to do
the
butternut
registry.
squash,
Oh,
cook it. puree it, cool it, and the kids loved it.
we should get that because I don't want to like give our baby from like the pouches and stuff like that. I know we talked about that before.
Yeah.
Um,
Homemade pouches are great though. I'm I
how do
hate.
you make homemade pouch? You can buy like a
There's
pouch
like
thing?
there's like a contraption that you buy that like you take the pouch and you force the food into the pouch.
Wow.
Yeah, it's awesome.
So would you be able to open it and clean it that way, or is it like a
Those
disposable
aren't.
thing?
They're not like the pouches themselves are disposable. You just discard them.
Okay.
But we did that for a while. Like I probably saw something on TikTok, and it was just like, it's on Amazon. It's not an expensive thing. You throw it in there, and even the tip. So like when the baby's young, the tips are like little spoons, so you can like squeeze it out and it goes
Ooh.
onto the spoon. It's so convenient.
I didn't even get that.
We did that for a while, and then that became like so much work. At some point, convenience.
This is like one of those things. This is one of those
function.
things where like the first and second kid get like the best of all worlds, and
Yeah.
then the second, as the kids go on,
Yeah.
it's like, all right, you get less and less.
Yeah, definitely.
I think I definitely need to get that. That's like, I think that's a good way of introducing food too.
It is.
Yeah.
It is. I think, what did we do? Like even pureed ground beef or something at some point.
You're giving your kids ground beef. Okay, hold on. He's giving his kids ground beef puree. That sounds disgusting. But when I introduce frozen mangoes and just ground beef on top, he's like, "No,
Mangoes
that's disgusting."
And ground beef do not belong together.
But you're basically blending ground beef and giving it to your kids.
It was a way of introducing texture, protein, like high. Like it makes sense. It was gross. I was like disgusted when we were doing it.
Would you have it?
No.
But
It
you
was
gave
gross.
it to your kids.
It was part of a process of introducing
food.
solids. So like,
I can see
from
it, I
that
can see
perspective, I was okay with it. From
Okay.
if
All right.
I had to turn that spoon around and put it in my mouth, it wasn't happening.
Have you seen those videos of people trying their baby's food?
Yes.
Corey comes up to me one day. She's like, "If you ever need me to try like a baby puree or food, let me know." I'm like, I don't. Who does that?
She has the pouches that what the kids had when they were 2 years old.
Those are different though. Those are like applesauces.
I can't wrap my head around it.
Those applesauces
can't.
are good. You think those are good?
I can't. I see it and I think a child should be
pass on
having it.
pouches.
Anyway.
I don't know.
All right.
Those patches, those are amazing.
All right. Let's get back to the PT realm for a minute. Talking about baby food and goat cheese.
Goat cheese puree.
Elvis, before we started this podcast, you were doing the red light therapy.
Red light's great.
You love it.
It's fantastic.
It's great. I love it. I'm a big fan. You basically do it after every shift.
Yeah, completely.
He did
You
this
love it.
morning when I walked in.
You've done it twice today.
Yes. So I usually split it up 10 minutes before work, 15 minutes after work, depending on my time. It just helps so much with inflammation, just like feeling tired, like lethargy.
Mhm.
It's awesome.
Awesome. Great. Yeah. I mean, to me, the benefits, people always ask, what are the benefits of it? And, there's a long list. And it's like once you've experienced it, you just feel the benefits. Like, I don't know how I'm just overly simplifying it, but to me, I get better sleep. I get a boost of energy. It's like it's awesome.
Like, so we have this panel at home, probably like a 1 foot by 1.5 foot panel that's much smaller than ours. But when Madison brought the idea of getting that to me, I was like, this is a hoax. This does not work. But let me tell you, as I'm like, when I have free time, I do go in the room as well, and I can definitely tell you, like, even though I don't have aches and pains, thankfully, but it does help my mood and stuff like that, and I do feel like more awake. It kind of is like the equivalent of drinking a cup of coffee.
Yeah, you feel that like
Yeah,
immediate improvement in.
Yeah, I just feel like much more
energy.
like at a good energy level.
Yeah.
As opposed to like kind of teetering all over the place and all the time.
Yeah. So once the baby comes, you're gonna be like living under that thing. I bet.
I might just sleep here.
You might just sleep here.
Yeah.
That's a great idea.
If I sleep here, then I won't be as responsible for it. No,
That's
fair. I'm just kidding.
That's fair. That's fair. Good. So we love red light therapy. It's great. Patients love it. People typically will do 20-minute session. They're $25 a session. And we also now have a monthly membership, $150 for the month, unlimited access.
Monthly is great.
Yeah.
Because the frequency with red light you find just helps.
Yeah.
All the
right. Like the research shows 3 to 5 applications per week is where you're going to get the most, therapeutic effects and benefits. So that's great.
We do offer it 24/7. As long as Elvis is awake, you can call him.
Yeah, it's not going to be me. All right. So, I brought this up today. I'm kind of on the fence about it. I was doing my own research on it. I haven't dove into the research, but shockwave therapy, what do you guys got? You got anything?
Oh, I don't know about that.
Okay, so we may not know anything about it. It may be something that we'll do our own research on, and maybe we'll touch on it on another episode.
Yeah.
But shockwave therapy, my buddy's got it in Dallas, and he kind of swears by it.
It might be a Texas thing. Like the only time I've ever heard about it is so when I was in Texas for a little bit, I worked 2 different places, and everyone kind of like brought that up to me and like were asking me about my opinion. I'm like, I have no idea what you guys are talking about.
Well, it's definitely not something I learned in PT school. It's not something you learned in PTA school. Insurance doesn't cover it. I think it's more of a cash-based thing or something you would just incorporate into your practice. So, to me, like, I love research, but I also love whatever works. So if that is something that could help the patients, then maybe going forward, that might be something we might think of incorporating. So we'll go back to that and touch on that on another day.
Well, like a lot of these modalities, not to cut you off, but a lot of these modalities, like I like to try it for myself before I like
of course
give it out. Like, I'm sure like you might agree with this, but like the whole ultrasound thing, like I'm not a big fan of it. I never was a big fan of it. Even when I went to PT for my own self, like people they would try to put the ultrasound on me. I'm like, I know I'm supposed to be feeling better, but I don't feel anything.
Well, we have an ultrasound machine here, and we do not use it.
Yeah.
It does not get used. Does not get touched. It hasn't been plugged in a few years. I guess maybe there's some indications for it, but I think that I think people sometimes are a little surprised that we don't use it, but that's part of what we're trying to do here, trying to be a little bit different, a little bit outside the box, and not go to the traditional modalities.
Yeah, I'm all for modalities. Like if they work and they put out the fire or make you feel better, even for the brief moment or long term, hopefully. Yeah, I'm all for it.
That's why I love the red light therapy device for the local inflammatory responses. I feel like patients just give immediate feedback. Like, I feel better when this is on. Like, it's pretty. Pretty standard.
When you see some of these athletes, like they're putting it on the actual joint as they move. Yeah. Maybe Aaron Rodgers should put on his Achilles while he plays. I'm just saying.
We're not going to talk about Aaron Rodgers until we get into OTAs. Oh wait, is that now? Are we in OTAs?
I'm pretty sure.
Oh no, this is
no, it's optional minicamps.
Yeah, voluntary minicamps.
Yeah.
Yeah. Apparently, he was dealing with a blister and limping around and stuff like that, and people were going crazy. I'm like, I'm not paying attention.
He's dealing with a blister. He's getting paid $200 million.
It was like on his Achilles too. It's like,
oh god,
I'm like, I can't.
These professional athletes, they get paid all this money, and they're just like, oh my pinky nail hurts. I can't play.
I can't.
But you see, but these hockey players, who
Truba,
did he play with a broken ankle?
Broken ankle.
He played.
Stud.
See that?
See,
he deserves everything he's got.
Yeah. Rodgers could have just put on a walking boot and been the Jets quarterback.
100%.
Definitely would have been better than Zach Wilson.
Hot take.
Hot take.
What do you think is better, Zach Wilson with Zach Wilson 100% or Aaron Rodgers with a boot?
Depends on who's on that D line.
Yeah. Yeah. All right. We're gonna start to kind of wrap this up a little bit.
That's good.
One thing we're going to incorporate into each one of these is, feedback from the patients, or some patients have questions, and maybe this will be a good place to kind of answer them. So one of our patients today, Krista, has been dealing with an Achilles tendonitis for a while. She's been battling the more she moves, kind of feeling like that tightness and restriction is limiting her. Yeah. And she wants to know, what are things she could do at home or in therapy that will help her, get on the other side of that. Yeah. So this segment, we're going to talk about manual therapy technique of the day and either a stretch or exercise of the day. And I'll talk first about the manual therapy component of it. So, you all know, I love my little toy here.
Dude, everyone always has so many mixed signals about this, mixed feelings about this. Yeah. Some people are like, this hurts, get this off of me. And some people are like, keep going.
Don't stop.
Yeah.
Yeah, hurts so good. So instrument-assisted soft tissue mobilization, it's a great technique. I mean, I've been doing this for 13 years. I basically based my practice off of this technique. It's a form of myofascial release, and especially in the Achilles posterior chain, at that myotendinous junction, even getting up into the trigger points, medial lateral gastroc trigger points. I just really find that when you mobilize the fascia, the soft tissue, just big improvements in mobility and range of motion. So this is a great technique, something that we do. I'll demo it here in a second. Kevin, what are your thoughts in terms of stretch or exercise of the day?
Well, for Krista, the main thing is we have been stretching her soleus.
Okay.
That seems to be doing a little bit better than stretching the gastroc, and other people would call it the calf.
Yeah.
Just because it's a little bit closer to the Achilles, I feel like, and it's doing her a little bit better.
Mm-hmm.
And what we typically do is put her foot on a wedge,
mm-hmm.
and then we'll keep the knee a little bit more bent to bias the soleus a little bit more.
Okay.
Compared to the calf with your knee straight. Yeah, I think she's been doing a lot better with that.
I love that because sometimes with these techniques, what happens is you get hyper focused on like one structure, and it's just like Achilles stretch, beat the tissue up, mobilize it, and it's like to maybe go.
Sometimes you have to go outside that box.
You have to. Go do a little soleus stretch. I love that.
Which is weird because like when you learn in school, it's like, okay, this equals this, that equals that, or like if this hurts, you stretch this, or if that hurts, you strengthen that, right?
Yep.
And sometimes that does work.
Yeah.
But sometimes if you notice something is not working, then you have to think outside the box.
Yeah. Good. So, we'll cut here for a second, and we'll demo the exercise and the manual therapy technique for you guys. But cut. Right, we'll cut. You could edit that, Elvis, right? Okay. Good.
Fix it in post.
Fix it. Yeah, there you go. So we're just going to kind of wrap this up right now. I think that this was kind of a good start. Give a little bit of physical therapy content, explain kind of what we do here at Cappy PT. And, what do you got? Final thoughts. What do you guys got? End of the first episode. What do you got?
Celtics winning the series.
No.
Celtics are winning.
We're leaving that segment out, guys. So
Mavs in 7.
Mavs in 7. So like that question that was just submitted for the Achilles, we're gonna put this on our newsletter. Amanda's gonna do that.
Yep.
These letters from Amanda have been great.
So good. 10 out of 10.
But she's gonna put this in the newsletter, and then we're gonna have a segment underneath that you can submit your own questions. And then unlucky person will get picked for next week.
And we'll gear our advice towards that question.
Yep.
Kind of show what we do, and we'll go from there. So, all right, boys.
All right, Mavs in 7.
Mavs in 7. Let's go, Yanks.
Let's go, Yanks.
All right, so we were talking about the manual therapy technique of the day, working with Achilles tendonitis. So this, again, is instrument-assisted soft tissue mobilization. It's a technique we use. Sometimes it's called the Graston technique. We are not Graston certified, so we do not say that. This manual therapy technique can be a little bit uncomfortable. So sometimes I'll just make sure the patient knows, like, let me know how my pressure is, how it's feeling. Some spots might be more comfortable than others. And as we're doing this scraping technique, we're kind of looking for either areas of pain, areas of soft tissue dysfunction. The tool will kind of give me some feedback on, what spots I should focus on in here. So right here, this is the myotendinous junction. This could be a spot where you find a lot of restrictions. Going down into more the Achilles. And like I said earlier, medial head of gastroc. It's kind of helping release some of that tension in that trigger point in that soft tissue. Lateral head of gastroc. Good. Feeling okay? All right. So like I said, this can be a very effective technique in terms of loosening up or improving mobility in the Achilles, ankle mobility. Typically, we follow that up with other manual therapy techniques, but just wanted to show you guys how we do that here.
Sure.
All right, just going to follow up with the exercise of the day. I'm going to have Chrissy put her foot that wasn't worked on the wedge. You're going to lean your knee forward a little bit and then push your body forward. So you should feel a little bit more of that stretch in the Achilles, lower calf area, as opposed to up here, where if you keep your knee straight and then keeping it straight, leaning your body forward, you're going to feel more in the actual calf muscle, right?
And
Yep. Did your ankle just crack?
Mhm.
Okay.
Yeah.
All right. With this one, we can either do back and forth, or I like to just have a stretch and hold it 30 seconds, 3 times. Or if you want to reduce the time, we'll just do more sets.